ensure that you let the patient know the various investigations he or she is going to carry out, even if he has to go so far, so that the patient will prepare his or her mind. Also, let the patient know if you are going to be the sole doctor to treat the patient, or if you are going to be enlisting other doctors who will come and visit and treat your patient, or you are going to refer this patient to other facilities for continued care. All this the patient needs from you, and you owe them the duty of care to let them know. If you do all this, the tendency to have friction with your patient will be very minimal. Then you should also be transparent with your billing. Let the patient know what the cost of your care is. If the patient can afford, the patient stays on. And if he cannot afford, then the patient goes. Hold no patient to yourself for pecuniary benefits. And you must be accountable. You must express accountability. You must take responsibility for your actions and inactions, even for the decisions you are taking, as well as the outcome of the care you have given to your patient. Do not shift blame. Take responsibility. And you must respect your patient by treating your patient with dignity. The patient is a human being. The patient is someone's father, someone's mother, someone's sibling. He has come to you in a very helpless manner. It does not mean that you talk down on your patient. No matter the pressure, you must be calm to be able to give out to your patient such that you will be a great physician. As a physician, if you remain like this with this training you have had, you are going to run into problems. So your clinical competence, you must continue to enhance. You must continue to attend workshops. You must continue to attend seminars, mortality reviews, review clinical cases, so that you will be up to date with what is happening. Even when you are alone in a place, join associations. The Nigerian Medical Association, at least once in a year and quarterly, they have meetings and they have continued professional education, which you can avail yourself with. You can also sponsor yourself to go and get more and better improved training. You can decide to go and do laparoscopic surgery elsewhere. You can decide to travel and to do minimal access surgery. You can decide to travel to do stem cell transplant, renal transplant, all whatnot. But when you are doing all this, doctor, you must always ensure that you do them within ethical limits. Resilience and dedication. There is no way you can practice as a doctor if you do not adopt resilience within you, because you are going to face a lot of things. In the medical practice today, when I practiced in Central Hospital Unicity, we were squeezing water out of stone. But the patient will not understand the pressures you are faced, the inadequacies you have, and the resource funding of the hospital. All they know is that I have come to see a doctor, so doctor provide you care. So you're going to face a lot of that, but you find a way of getting across all this. The journey is not easy, but most of us have gone through this journey and we have come out of it and been able to nod our head and say, like the Agama lizard, we say, yes, that's right, I've done it, we've all done it. And there are so many people we can name who have written their names in the sands of time. We will go there when I talk about advocacy. In terms of lifelong growth, you must try as much as possible to update yourself, which I've said. I've talked about that. And you must regularly do a self-reflection. A doctor who does not reflect and reassess himself or herself may run into a lot of problems. How well am I doing? What are my strengths? What are my weaknesses? How can I improve on them? You cannot know it all. And then you must also adopt mentors. Mentors that can mentor you positively towards achieving the goal of becoming a great medical or dental physician. And you too, when you have grown, must also be willing to be a mentor to others. So you must be exemplary so that they can adopt attributes from you, so that they will be able to practice effectively.
Okay.
Always stay updated, seek feedback. Always ask your patients when they come for follow-up care, how do you see the care I'm giving to you? Tell them to be sincere. And don't feel bad if the patient says, Doctor, you are always too much in the worry. You know they listen to person. Before I talk, you don't write. Doctor, make you they listen to me. It helps you. So that subsequent patients are